One of the reasons why you're not getting pregnant is that you might have an ovulation disorder. What's up, beautiful people? Welcome to another exciting episode of TTC Diaries with Dr. O. You already know. And today we're going to be talking about something very important that concerns all TTC moms. We're going to be talking about something very, very important for TTC moms, right? If you are trying to conceive, especially if you've been trying to conceive for a while without success, one of the questions you'll be asking yourself is, why am I not getting pregnant? Like, what exactly is wrong with me? What could be the problem? And that is exactly what I'm about to answer today. You see, in trying to conceive, there are many factors involved. There's the male factors, which is your partner. There's the female factors, which is you, right? Other things to consider, like the timing of your intercourse, the frequency of your intercourse, and all that, right? So today I'm going to be discussing 5 reasons why you may not be getting pregnant, okay? My number one reason, or the number one reason that affects a lot of women, is ovulation disorders. So what's ovulation disorders? One example of an ovulation disorder is something that we call polycystic ovary syndrome. That's PCOS. I talked about it in one of my videos, which I'm going to link somewhere down below, or you find it in the TTC Diary playlist, right? Polycystic ovary syndrome. So this is a hormonal disorder that affects most women of reproductive age. Usually people that have polycystic ovary syndrome, they are not able to produce eggs like the way they should, right? So their body is probably not releasing eggs or not releasing it regularly. That's a topic for another day, or that's a topic I've already discussed, so check it out in my previous video. And then another type of ovulatory disorder can be hyperplax anemia. So prolactin is the hormone that is responsible for making your body produce milk, so lactation. So when you're pregnant, and you give it to your baby, you're supposed to produce milk so you can breastfeed your baby. So when you have excess of this prolactin hormone, it's called hyperprolactinemia. Now you might be wondering, what's the connection between prolactin and me giving birth? Well, it's pretty simple. When your body produces excess prolactin, it actually affects the hormones. It suppresses the hormones that are supposed to help you ovulate, right? Because when you're breastfeeding your baby, your body doesn't want you to produce another baby, so you can concentrate on breastfeeding the baby. Like I explained in one of my videos about breastfeeding for new moms series, you can also watch that because you're going to be a new mom soon, so you need to learn these things. Prolactin suppresses this hormone and then it affects your ovulation, so you're not ovulating the way you should. Your body's not releasing eggs appropriately or not at all. That's that about hyperprolactinemia. So one of the reasons why you're not getting pregnant is that you might have an ovulation disorder. So you might want to check that with your doctor. Am I ovulating properly? Because if you don't ovulate, let me tell you the importance of ovulating. Ovulating is when your body produces egg. You see, egg, that is your seed. That is what you need to have a baby, because you need to have an egg fertilized by your partner's own seed, which is the sperm, and that will now form the embryo, which is your baby. So two unite to become one. So you need to have that egg to be able to have a baby. And if your body is not producing the egg, how will you get pregnant? Your partner can produce as much sperm as he likes. If your body is not producing egg, you are not going to get pregnant. So we need to make sure that your body is producing eggs, that is ovulating appropriately. So make sure you get that checked in the hospital. Another reason why you may not be getting pregnant is uterine abnormalities. As we all know, uterus is your womb. So if you have any abnormalities with your womb, it might actually be preventing you from getting pregnant. For example, if you have something like fibroids, some women that have uterine fibroids actually have problems getting pregnant, right? Because the fibroids might interfere with the implantation. So even after the fertilization happens, the embryo is not able to implant in your womb because of the fibroids, or sometimes they even successfully implant, but then they have miscarriages because of the fibroids. So that might be another reason why you're not getting pregnant. So now we've talked about your ovulation, we've talked about your uterus. Another reason why you may not be getting pregnant is if you have problem with your fallopian tube. So for example, if your tubes are blocked or your tubes are damaged, then it's going to be very difficult for you to get pregnant naturally. So let me explain. When your body produces eggs, that is the ovary, so your tubes are like hanging like this, right, waiting to collect the eggs that your ovary produces, right? So when your body produces that egg, it travels down the fallopian tube to be fertilized by sperm. So just imagine that your tubes are damaged or your tubes are blocked. Your body will produce the egg. When the egg wants to travel down, the tube would have blocked the way. There will be roadblock, so the egg will not be able to pass to be able to go down to be fertilized by the sperm, right? And every time your body is produced, so you don't have ovulation problem. Your body is producing egg, but egg is not meeting the sperm because there's a blockage. That can be a reason why you're not getting pregnant. Luckily, you have 2 tubes. If there's a blockage in one, another might be open, but then it depends on which ovary produces eggs during that time in your cycle, either the left or the right. Sometimes the left can produce, the right can produce, or both can produce at the same time, right? So it really depends on which ovary is producing eggs. But if you have a blockage in any, it could diminish your chances or prevent it totally, because some people have a dominant ovary that produces more eggs. Sometimes you find out that egg is being produced on one side more than the other, right? So you might want to check that in the hospital. Go for a test to make sure that your tubes are not blocked and your tubes are not damaged. Some of the things that could cause tubal blockage or your tubes getting blocked is when you have an infection called pelvic inflammatory disease. So pelvic inflammatory disease could be caused by sexually transmitted infection. So sometimes some of the symptoms could be lower abdominal pain, right? Some of the symptoms could be vaginal discharge, right? So if you've had any infection in the past, genital tract infection, it could have actually affected your tubes and led to tubal blockage. That's why it's very important to protect yourself against sexually transmitted and other genital tract infections. Another reason why you may not be getting pregnant is if you have something that we call pelvic adhesions. So pelvic adhesions are when like scar tissue is formed, right, and it causes like your organs to start to stick together. So scar tissue might actually cause tubal blockage, because if the tube fuses together with, for example, your abdominal wall, it causes blockage that is preventing the egg from going down. That's just an example. So basically, how do you get scar tissue? If you've had a previous infection like pelvic inflammatory disease, you could get scar tissue in your pelvis. If you've had previous abdominal or pelvic surgery, like for example, you've had an appendectomy for appendicitis or any other type of pelvic surgery, like you could have adhesions that could also prevent you from getting pregnant if it leads to tubal blockage. So the last reason I would like to talk about why you may not be getting pregnant is something that is called endometriosis. I'm going to do a whole video on that very soon, so make sure you look out for that. Okay, so what endometriosis? This is when the lining of your uterus, so endometrial lining, so endometrial lining is like the bed sheet of your uterus, like that's the surface of your uterus. So when you are finding like those linings, right, growing outside of the womb, so your uterus is your womb, so when it's now going outside of the womb, so you find it maybe in the abdomen or other parts of the body, right, this can actually prevent the way your uterus works. It can affect your ovulation, and it can affect the function of your fallopian tubes, right? So this might be another reason why you're not getting pregnant. But if you've been diagnosed with endometriosis, don't worry, I have another video coming up where I explain everything in depth. Okay, so there are other reasons why you may not be getting pregnant. Like I said, today I did not discuss the male factors, right, and these are only some of the female factors, okay, but I just thought to mention these 5 because they are very common and they are very important. If you feel that you may have any of these conditions that I just mentioned, please make sure you go to the hospital to see a doctor to get checked so that it can be resolved and you can have your baby soon. Remember, we're all in this journey together and we're really looking forward to you having that baby. If you're enjoying this video so far, don't forget to click the like button, subscribe, and share with anyone you think might need to see this. Always remember that you're not alone on this journey to motherhood. Keep your eyes on the prize and your baby will be here sooner than you think. See you next week.